Hello, my name is Eunice. I'm a registered nurse and the owner of Florida Training Academy. During my 23 years as a registered nurse and a nurse educator, I've had the pleasure of being able to train thousands of nursing assistants, nurses, and also nursing students. And across the board, by far, one of the hardest skills it is for a CNA, a nursing student, or a nurse to master is that of taking the manual blood pressure. Not just using the sphygmomanometer, but also utilizing the stethoscopes properly. I want to show you a couple of the stethoscopes that we use here in our facility. The first is a training stethoscope. I want you to look at the length of this tubing. If you've ever trained anyone to take a manual blood pressure, what you know is that if the tubing is long, that allows for extra interference. The tubes actually connect in the center, but this allows the nurse or the instructor to listen through one earpiece and the student to listen through the other. And you heard that already. Yes, it can be a little chaotic because the student's nervous, they're shaking, and then of course this extra tubing doesn't make listening to heart sounds or the blood pressure any easier. So this is one of the devices that we use in our facilities. Another device we use is just a traditional stethoscope. And this, of course, it works. However, as an educator, as an instructor, I can't listen at the same time as my students are. So it's either my student is listening or I'm listening, but we can't listen simultaneously. So even a traditional stethoscope has its limitations. What if I told you there's a better way? What if I told you there's a wireless stethoscope? Yes, there is. It's called the Stemoscope. This is my Stemoscope, everybody. Right now it's in this leather pouch, which is wonderful. It fits right into my pocket, and I can just simply share my earbuds. I've worked in numerous colleges that had earbuds or AirPods, and what you do is you connect your AirPods wirelessly to the Stemoscope, and that way an instructor can listen to one earbud and a student can listen to the other. We can listen to the heart sounds, the blood pressures together without the excess tubing and without there being more interference. So I want to show you my wonderful Stemoscope, everybody, my wireless stethoscope. This is the pouch that I'm crazy about. It attaches right to my waistband, or I can stick it into the pocket of my uniform, along with my earbuds. So it's just really user-friendly and it's small. I don't have to have that heavy stethoscope across my neck, and whenever I'm training my students to do their blood pressures, I don't have that excess tubing, so it makes listening to a blood pressure that much more easier. This is it, everybody. This is my new best friend. This is the Stemoscope, and it connects wirelessly to the earbuds. Once I power it on, we're going to have an earbud in my ear and also an earbud in one of my students' ears, and she's going to demonstrate next how to take a manual blood pressure for the first time. This is her first time ever taking a blood pressure while using the Stemoscope. So just stay with us. All right, and so yes, you want to open. And so whenever you're applying your cuff, you want to make sure it's not too big or too small, because it can give you a false high or a false low reading. And then we talked about the brachial artery. The brachial artery is right here. If you'll go ahead and feel, press in. And so this cuff has a brachial artery indicator. And so it says you have my right arm, and so that arrow should be pointing towards the brachial artery, and that's where you'll also be placing the Stemoscope. All right, so and now you got to bring it up about 2 inches above the anacubital area, and we like to say about 2 finger breaths. So if you turn your fingers, yeah, and so that will ensure that you have enough room for your Stemoscope. Okay, all right, so take this hand and hold the Velcro. Take the other hand and wrap around tightly. Good snug fit. And then the cuff should always be at the level of the heart, so you don't want it too high up or too low, so this will be perfect. All right, and so now you can see everything. Let's go ahead and put our earbuds in. All right, so everybody, with the Stemoscope, we get to put our wireless earbuds in, and she's going to use this wonderful device. It's a wireless stethoscope in order to hear my blood pressure. So let's go ahead and insert our earbuds. And so, go ahead and press in. And which hand are you going to use to inflate your bulb? You want to get comfortable. Just like this. Good. You turn it to close it. Remember, you want to turn it towards me. And you want to press in just a little bit. Okay. Try to get all these cords. I want them twisted. Good. And don't let it hit the Stemoscope. If you can, hold it to the side. You can go ahead. Pop a little more. Get it done. For me, take it to about 160. Control it, 2 fingers on the dial. Slowly. You hear it?
Yes.
When you don't hear anything else, you can release all the air. How cool was that? No stethoscope, no like long tubes or anything.
That's so nice.
Awesome. Do you want to try it again on the opposite arm?
Yeah.
Okay. And now here's your Stemoscope. How do you want your hands placed? It may be a little bit awkward because the table's here, but it's this time. Do you want to hold the Stemoscope with your left hand and the bulb with your right? Good. Okay.
You want to make up to 160?
Yes, please. So usually about 40 above the normal systolic.
Oh, too far.
It's okay. Control your dial. When you don't hear anything else, what do you do?
Release the...
Great. May I hold a Stemoscope?
Yes.
You all, I am loving the Stemoscope. It's portable, it comes with a carrier, and best of all, especially for a nurse educator, I don't have to have a double training stethoscope. It allows me to train my students. I can hear what they're hearing, so we can actually, learn in real time and teach in real time. So I will make sure I have the information in the description area below. And what are your thoughts about the Stemoscope?
I love it. I love technology. It's so advanced right now.
Too.
I appreciate it. I know everyone else will appreciate it as well.
All right, so I'm going to turn this off, and then we can take off our earbuds.
Okay.
So as you can see, using the Stemoscope is going to help save you time. It's going to help your students to be able to hear the heart sounds better, to hear lung sounds better. It's small, it's portable. You can put it in a case. It can clip onto your clothes. It can clip onto your badge. And again, best of all, it alleviates the need for these extra antiquated, these old-fashioned stethoscopes. At the end of the day, I don't want to have a stethoscope around my neck, and if I put this anywhere, someone could actually walk away with it. This just goes right into my pocket. I tote it with me, I can clean it with alcohol, and I can use it on multiple patients, and the battery life lasts for a whole shift. So again, this is Eunice Mathis with Florida Training Academy. I'm going to have information in the description area so that you can research, so that you can buy your Stemoscope. I hope you like it as much as my student and I do. All right, everybody.